Alright, so hi everyone, my name is Katie and we will be talking about the rabies virus, which is a viral zoonosis, meaning it's caused by animals. Alright, so let's take a look at the microbe Rhabdoviridae under the microscope. This is what it looks like. It is a bullet-shaped microbe, and we will talk more about its structure on the next slide. Alright, so the structure is a bullet shape. It has tiny projections of glycoprotein, about 400 per molecule on each single microbe. So it's a pretty nasty looking microbe. All those glycoproteins encase a single strand of RNA in the center. Virulence factors include that it has multiple thick layers of proteins. It's very good at hiding. So what happens is it gets inside you through an open wound, usually caused by a rabid animal. The saliva then gets inside you and your cells ingest it through pinocytosis, where then it's allowed to replicate and multiply, and then it reaches your nerves, usually your peripheral nerves first, where it then goes from your peripheral nerves into your spinal cord and ultimately to your brain. So it's not cytotoxic at all. It actually just lives inside your cells normally and is totally fine living there. It is a neurotoxin though, a very virulent neurotoxin, and we will talk about the effects of that neurotoxin in just a moment. Alright, so who's at risk for rabies and what are the rabies reservoirs? So, mostly animals are at risk for rabies. It's transmitted through wild, warm-blooded mammals such as cats, dogs, raccoons, skunks, foxes. Here I've included a little table that the CDC came up with of what areas are most at risk for what type of rabies transmitted through animals. So we see here on the East Coast raccoons. In the middle it's mostly skunks and a few foxes. So the domestic risk of rabies is your animal getting bit by a different animal, a rabid animal. As we all know, rabid animals are incredibly aggressive and they have very aggressive tendencies because the rabies virus has reached their salivary glands, and it causes them to just have this urge to bite. So they bite pretty much anything they can get their hands on. So if an animal comes into contact with another rabid animal, specifically your domesticated animal, it will probably try to bite it, and if it's successful, then you might not notice it for a couple of weeks until your animal starts to have symptoms of the rabies virus. So that's one problem with rabies, is that animals that we domesticated are getting bitten. So like I said, there are a couple of ways you can get rabies. Most commonly, it's through a bite from an infected animal. You can actually also get it through the saliva of an infected animal via indirect contact. So the animal does not bite you, but instead you get saliva into some kind of break or open wound or mucous membrane on you, and then you can contract rabies as well. That's very rare. It doesn't happen very often, but it can happen. So human-to-human contact is another way we can get rabies. This is incredibly rare, but a person can actually bite you. If the person has rabies, they can bite you, and then you get rabies as well. There have also been a couple of documented cases of human organ transplant where the donor had a rabies infection, and then they transferred an organ from the rabid person into the normal person, and then the normal person got rabies as well. So, that doesn't happen anymore. They do lots of tests on your organs before they go throwing them into other people's bodies, but there have been a couple of documented cases of that. Alright, so rabid bats. A lot of people, when they think rabies, they think bats. They think all bats have rabies, and that's not actually true. I'm not sure why this is so prevalent. I know a ton of people who think that all bats have rabies. But bats are actually no more likely to carry rabies than any other animal. However, bat bites are incredibly small, they're not very painful, and they're anaerobic, which means they close up before being able to be properly washed. That's just because their mouths and their teeth are so small that they bite you, and you don't really notice. It feels like a pinprick, and usually if you're going to be bit by a bat, you're in some kind of adrenaline-induced situation. Maybe a bat is flying at you in a cave, and you're swatting or running or trying to get away. And so your adrenaline's up, you're not going to notice the little pinprick, and then it's going to close up, you're not going to see an open wound, you're not going to feel much pain. So they don't seek medical treatment. So you are actually a lot more likely to be killed if you are infected by a bat, just because of those reasons. Still, it doesn't occur quite as often as people seem to think it does. Alright, so some signs and symptoms of rabies. Patients will first present with mild flu or general viral type symptoms, the fever and the fatigue and the headaches. But then the rabies virus will take one of two paths. Oh, I just wanted to note here that once the clinical symptoms set in, the fever and the fatigue and those type of symptoms, rabies is almost 100% non-curable. There have been less than 10 documented cases of people who presented these symptoms surviving their rabies infection. So rabies is considered by the CDC to be 100% deadly. So the rabies takes one of two paths. It can either be paralytic rabies, which is where the rabies basically causes you to be paralyzed first at the infection site, and then it usually works its way up your body and you fall into a coma. You ultimately die from paralysis. You're not able to breathe, or your heart isn't able to beat, whichever one comes first, and you die. Furious rabies is the much more common type. About 80% of people who contract rabies get the furious rabies. And this is the one that is so famous that everybody knows about and everybody is scared of. It's been an Old Yeller. Old Yeller got rabies. And then also, I know that Left 4 Dead, the video game, has their zombies are the rabid zombies. So this is where the people are paranoid, terrified. They have hallucinations. They also have difficulty swallowing, over-salivation, they'll spasm, and the classic hydrophobia. I actually looked it up, and hydrophobia is kind of a secondary type symptom. Usually first comes the difficulty swallowing. Your throat will not allow you to swallow anything. So the hydrophobia is kind of a secondary blame type of situation where you can't swallow, so you're afraid to swallow, so you don't drink any water or anything, which everybody needs to live. You'll experience an intense surge of hyperactivity, and also then you will die by cardiac arrest. Alright, so treatments. What can be done about rabies? Pre-exposure vaccines are given, and these are mostly given to people in high-risk areas or situations, and that's in areas where people live with lots of rabid animals. Park rangers, animal control, disease control workers are all given rabies vaccines just to prevent any kind of bad reaction in case they are bitten. It makes treating them if they are bitten a little bit easier as well, but most of us are not vaccinated for rabies, so we are given what is called post-exposure prophylaxis, which is mandated by the World Health Organization. And there are a few steps you have to go through. First is extensive washing of the infection site, and then you're given a vaccination. The vaccines are given at in intervals. You have to get a vaccine on day 3, day 7, day 14, and then day 30. You're not allowed to miss a dose, or the rabies will probably come back. You're also given an injection of rabies immunoglobulin, and this is either through human rabies immunoglobulin or equine rabies immunoglobulin. And this is what everybody thinks of when they think of the really big, hefty shots. They have to give it to you in the infection site as much as possible, and whatever they can't fit in the infection site is given to you in your gluteus maximus region. So that's not a fun time. Alright, so prevention is the best form of treatment. Vaccinate your pets. Don't let them wander around without supervision. Don't let them play with dead animals. Don't let them play with alive animals unless they're other dogs that you know have had their vaccines. Also, you should consider the rabies vaccine for yourself if you're traveling to developing countries a lot, or if you spend copious amounts of time outdoors, you should get the rabies vaccine, just because you'll probably come into contact with a couple of different types of critters that might be infected. Alright, so the global risk of rabies, it's very common in developing countries like Russia and China and Africa and South America. This is just because they have less access to healthcare than places like America and Canada, and Australia, of course. So the biggest thing with rabies is prevention before it happens. And this is in the form of knowledge and vaccines. And developing countries don't disseminate knowledge quite as quickly and efficiently as the US. So a lot more people are prone to getting rabies in those types of areas. All right, so there actually is some good news. There's one place that doesn't have rabies, and that is the great state of Hawaii. So the CDC has told us that there is absolutely no rabies in Hawaii. So you pack up your pooches, you move to Hawaii, and you will have to go through a very extensive process in order to make sure that they have no diseases in order to live in the great state of Hawaii. So go live in Hawaii with your pups, and you will be rabies-free forever. All right. Thank you for listening to my presentation on rabies. I hope you enjoyed it, and I'm looking forward to listening to all of yours soon.